Arlington Police Department is recognized as a model facility once again. This time, it's because of their response to incidents regarding mental health. In February, the Department of Justice designated the Arlington Police Department a law enforcement mental health learning site, along with 9 other departments across the country. Law enforcement organizations looking to improve their response to mental health-related calls are encouraged to visit and observe Arlington Police.
When someone would reach out for help, or if the DOJ wanted to push someone and say, hey, listen, you might want to talk to these folks. These folks have a pretty good plan in place. They're doing some great work. You might want to talk to them.
Arlington has been developing their response plan since 2010. They've now joined the One Mind campaign, a nationwide initiative to provide mental health first aid training to officers in an effort to de-escalate police interactions with those suffering from mental health crises.
Times have changed, and it's part of what we do now as a police department is dealing with, those people in our community who are dealing with behavioral issues and can be in crisis. So this was an easy decision for us.
According to a National Public Radio report, approximately 10% of police calls are now related to an issue regarding mental health. Some departments have incorporated in-house mental health clinicians to respond to the increase. Rebecca Sopolis is Arlington's clinician. Part of Sopolis's job is to educate and assist officers dealing with these situations. Arlington uses a co-response model where the clinician and the officers work together to ensure every incident is a learning experience.
When we're riding in a car together, that's honestly the most hands-on way to learn, right? Because we're understanding what needs to happen from a police perspective, from a mental health perspective, and just using that knowledge together, every time it just gets better and more kind of seamless.
In compliance with the One Mind Pledge, all of Arlington's police officers are trained in mental health first aid, and more than 20% experience in-depth crisis intervention training.
But when you're sitting beside them, you're aligning yourself with them. It's a very different message than when you are facing someone and talking to someone face to face. It's that simple move of, I'm with you, as opposed to, I'm kind of at you.
The goal is to give officers the tools they need to de-escalate the situation and to find alternatives to arrest. Sopolis then offers personal follow-up.
At the beginning of every day, I look through kind of all the reports that have happened when I'm not here, and then I will usually go out with an officer to respond and to provide outreach.
Having a mental health clinician in the community gives those suffering with mental health disorders someone to call, freeing up 911 lines for emergencies. In our next story, we'll be looking at policy changes regarding mental health and how that impacts the Arlington community. For APN, I'm Tyler Robichaux.